What up, world? It's your boy Matt Mills, the host with the most. Don't need to brag about. All I do is give a toast to the real folks who done paved the way in a real way.
I'm Dr. Ann Schuchat, Principal.
Are we gonna listen to the CDC
the Centers for Disease
coronavirus
Control and
update
Prevention, which has been
and see what they're talking about
monitoring
the
and
outbreak?
responding to the outbreak of respiratory illness caused by the new coronavirus, first identified in China. As of this morning,
Wuhan, China, to be exact.
report more than 1,000 deaths and more than 42,000 current
More than
cases
1,000 dead.
of coronavirus. More than 7,000 of the affected patients are reportedly in critical condition. The death toll has now eclipsed that of the 2003 SARS outbreak. One American patient died in China over the weekend. The CDC is now
Was that American
evaluating
patient Chinese
more
or
than
white?
400 people in some 40 states.
Because when
and
you say American,
territories
I
here.
don't know.
So
I
far,
don't understand what the fuck that
13
means.
have been confirmed to have the virus. While the outbreak has been designated a public health emergency in the United States, and imported cases in travelers have been detected, with some person-to-person spread among those with close contact of returning travelers from Wuhan City. According to the CDC, the virus is not currently spreading in the U.S. Over the course of her distinguished career, Dr. Schuchat has played key roles in the CDC's emergency responses to the 2009
The attempt to
H1N1
destabilize
pandemic
China's
influenza
economy
response,
has
the
begun.
2003 SARS outbreak in Beijing,
Y'all take a
and
look
the
at it.
2001 bioterrorist anthrax response. Dr. Schuchat has also worked on meningitis, pneumonia, and Ebola vaccine trials in West Africa, and has conducted surveillance and prevention projects in South Africa. Following her remarks, we will take your questions from your seats. Lindsay Underwood will bring the mic around to you so you can ask your questions on mic. Dr. Schuchat, thank you very much for joining us. The podium is yours.
Let's see what this Dr. Schuchat has to say.
Well, good morning, and it's a real pleasure to be here. Thank you for inviting CDC to this Newsmaker event and for giving me the chance to provide some remarks. What I'd like to do today is provide an update on the situation with the novel coronavirus outbreak, as well as some reflections on this outbreak in the context of other emerging infectious diseases that we've had to deal with, and the US CDC's efforts to prepare, prevent, and respond to this type of concern. So to borrow a phrase from Tolstoy, happy families are all alike. Each unhappy family is unhappy in its own way. Emerging infections, including novel respiratory pathogens, are each unfortunate in their own way. So while we have learned from SARS and MERS and both avian and swine influenza experiences, and from each of the major influenza pandemics of the last 100 plus years, each had a different impact. Encountering the emergence of the novel coronavirus spread in 2020 has been challenging and reminds me to be humble. We plan and strengthen our preparedness efforts here and around the world, and these efforts are very important. We try
Reminds
to
her to be
avoid
humble.
the
What the
problems
fuck
of
does
the
that mean?
past and assure that there is capacity to find, stop, and prevent outbreaks at their source, and work together as a global community when any individual nation's resources are overwhelmed. That's the very essence of the global health security work ahead of us. But each new emerging infectious disease can present us with surprises and new chances to improve our response and prevention efforts. The
Global
current
health
situation
security
with the
work.
novel coronavirus is dynamic. There are very different circumstances.
They're doing this
Wuhan
under the
and
guise of
Hubei
helping the
province,
whole
China,
world.
than in the rest of mainland China, and very different from in other countries around the world. The circumstances in the different settings require different responses, different intensity, different strategies. Here in the United States, as you heard, we have 13 confirmed cases of novel coronavirus occurring in 6 different states. We have active efforts to find and evaluate people who are under investigation as possible cases, and we're supporting state and local public health to investigate those individuals, and when cases are confirmed, to do contact tracing and understand the spread that has occurred or that might occur around each one. Of the 13 cases here in the United States, 11 occurred in individuals who themselves had traveled in Hubei province or in Wuhan. 2 of the individuals had very close contact, household contact, husband and wife contact with one of those cases. We do not have widespread transmission here in the United States, and we are currently operating under a strategy of trying to delay the arrival of individual cases and to slow the spread of cases should they occur. The CDC has taken aggressive action. We have over 800 staff involved in the response. More than 200 have been deployed around the country. We're carrying out surveillance, laboratory testing. We're supporting responses at 5 military bases around the country where the State Department had carried out charter flights to bring individuals
The CDC,
back from,
Center for
Wuhan.
Disease Control.
We have
Control,
efforts going on in
disease
airports around the
control,
country, primarily
not
11
prevention,
airports where direct or
not
indirect
disease
flights from
eradication,
China or
disease
passengers
control.
originating in China are arriving.
Because diseases,
We're working
they
with
can't
Customs
really
Border Patrol and the Department of Homeland
let's say,
Security in conducting
annihilated.
screening to look
They
for
could
ill
only
people
mutate or
and to
like
identify people
carry
with a
on,
history of travel
take on
to
different
Hubei
hosts, right?
province. We're also supporting a number of epidemiologic investigations around the individual cases. We have staff in over 60 countries as part of our routine global strategy, and they're supporting the ministries of health in those countries in preparedness efforts and surveillance and detection so that they can be ready should cases arrive. We've been carrying out outreach to clinicians about how to evaluate people for possible novel coronavirus and how to care for them and how to safely protect themselves from acquiring infection in the healthcare setting. Intensive work with our public health partners at state and local public health jurisdictions who are really on the front line of this response. We're of course working through the media and with other channels to reach the public so that everyone knows what they can do to protect themselves and their families and what to expect in the weeks and months ahead. We've also been reaching out to the business sector and private sector about their role in this response. Of course, our world is so interconnected that many, many private and public sector institutions have installations all around the world and workforces in many areas. I want to mention 2 updates from yesterday. Today is the 14th day of the quarantine of individuals who were on the first charter flight returning from Wuhan province. They're currently being assessed to make sure that they remain symptom-free, and then we hope that they'll be released to travel on to their home today. So that's one milestone that we will be hopefully celebrating later this morning. A second update is the first case detected in California in an individual who was part of another group that was repatriated from Wuhan, one of the subsequent charter flights. The individual is being cared for in California, and that person is now our 13th case that has occurred in the 6 different states. I know that everyone wants to know what to expect going forward, what is the trajectory that we'll see with this, and certainly it's a very intense situation in Hubei province in China, in several other provinces where the Chinese authorities have taken very aggressive measures to limit transport out of the area and to prepare their healthcare sector to surge with the great increase in cases that's occurring. As you heard, over 42,000 cases in China, the vast majority in Hubei province,
Okay.
where extreme measures are being taken
I'm coming.
to keep up with healthcare challenges and to support the communities that are pretty isolated right now from the rest of the country.
That goes to show y'all, man. Y'all don't want to mess with that Wuhan virus, but they look like they got it under control for the time being. But I don't put nothing past these motherfuckers, man. This one?
Yeah.
You know what I mean? They telling us they got milestones and they're overcoming all this adversity but do they have a cure? No. They got 800 staff. Blah blah blah. All I want to know is this. Did y'all cure the disease or not? And if you didn't cure the disease, who's gonna cure it? And how do we know if it's cured or not? And how much people are infected in the States and in Canada? There's a lot of questions that need to be answered before we go ahead and take whatever they say at face value. Can you dig it? There's not a lot of things are left up for questioning, you know what I mean? And I can't respect that. The whole perspective is whack.
What the next few weeks and months will mean. Our current strategy is really a containment one, focused on our borders and focused on intense evaluation around each confirmed case.
Oh, so they're just trying to contain everybody. Like I said, a way of controlling the Chinese population and also to destabilize the Chinese economy. Because they see how the Chinese are moving with great force. They want their dynasty back. And they're tired of this fucking white supremacy, them damn selves. But some of them, for the most part, are in cahoots. You're in collusion, you know what I mean? So we shouldn't take too much of what they say at face value.
That can really help put the diagnostic information.
We could only give so much representation to this. Well, we really have to watch this shit closely. Now, the correlation between this and Kobe. Let me just break it down for y'all real quick. Kobe was bringing, as Umar Johnson said, Kobe was building a vast empire in Red China. That would have rivaled the NBA, crippling the economy in the United States. Because to them, they have such a arrogant disposition that nothing could cripple their economy. They have the best institutions in the world. They run everything. Everything has to go through them. You know, the United States way of thinking. The real detrimental causes of certain situations in our society. Now, if we are to give lip service to this, we should know that one, Kobe is a very rare and expensive
the State Department also
protein
authorized departure for their employees
steak around the world. Kobe beef. And they love that shit in China. So imagine consuming Kobe
does this compare?
No,
to
in the not in the literal sense, but in the
that epidemic
colloquial sense.
affected many countries, hotspots in China, in Hong Kong,
And giving
in Toronto, Canada, Vietnam.
the world
But this outbreak is spreading much more quickly than SARS did.
Kobe Bryant,
See from
the leader of
which the virus
Chinese
is
basketball,
spread into
international
many countries,
basketball,
more than 2 dozen right now, that this
along
virus
with
seems to be more transmissible than SARS.
the homie that's already playing up there, the big head.
The current information suggests that this virus overall may be less severe than SARS.
Shit, what's his
Among
name
the
again?
confirmed or cases of
Well, y'all know
SARS,
who I'm talking
it was
about. The
one
big
in
head.
10 that
He
resulted
used to
in
talk a
death.
lot.
The current estimate from China of the cases they're aware
He
of
played in China.
is
He
that
he
it's
he
about
had shoes
2%,
made for cheap too.
result in death. But that
Just like
number
Shaq.
really needs to be put in qualification.
See, Shaq is all about
Because
making
the
ads
level
and
of illness is
acting
such
for
that they
these
haven't
fucking
really
corporations because
broadened the
his
ability
brains
to
is
track
not
the
as
viral
focused,
illness that
nor
they're
as
trying to present
he as hungry
to
as
care.
Kobe or
So
was
the
as
transmissibility
relentless
of this virus
and
may
as
be
passionate for the game as
perhaps more
Kobe
similar to
was.
influenza or the
I can
common
tell you
cold,
that.
and the novel coronaviruses
So now
relate
we know
to common cold viruses
the
and other
Wuhan
viruses. The
virus started the
transmissibility is a
same day
big
Kobe
concern
died
for
of his
whether
helicopter crash.
containment is
Kobe
feasible.
beef is
So
some of the
far,
most
our strategies
finest
seem to be
prime
working
meat
here
in the world.
US, but it may be that with
He
additional cases,
has an empire,
particularly
was
if
building
they
an empire in
don't,
China
involve
with a
symptoms
basketball
or very mild
league
symptoms,
that
then it
would
be
rival
more
the
difficult to block
NBA,
the spread.
going to
When
war with a
containment doesn't
pharmaceutical
work,
company
our next strategy
that was
is
putting
really
illegal
about
substances
slowing the
into
spread,
their products
delaying
called
the peak
the
of
Black
illness.
Mamba.
That's been part of our pandemic plans all along to actually reduce
And now
the spread.
we're at this
of the
situation
virus
where
from
it's
person to
like
person.
no one's
And
going
that
in
can
and
be
out of
done
China.
with
Let's keep listening to this.
measures like social distancing, having more people telework. Occasionally, we may go to school closures as we did at the beginning of the 2009 H1N1
Social
pandemic.
distancing.
Really trying to reduce crowds and mass gatherings, and really that is what is being
Reduce crowds and
implemented
mass
in Hubei
gatherings.
province. Another intervention that has been used in large scale in China is the use of quarantine, and that is a strategy where people without any symptoms are cohorted or asked to stay home alone and to not come in contact with others. A quarantine is when
So imagine to implement that down here because they have such a scare that it's gonna spread and everything like that. How would destabilize the economy over here? But they won't do that over here. You know why? Because they're trying to get back into the swing of things. They realize China is reproducing and they kept their currency at a low level so they could build up their economy. And they want to break that.
As I said, the first of the
So
charter
when they
flights,
talk about
groups is
protesters
completing
in
their
China
14-day
and all that,
quarantine today.
maybe they're really
We hope they'll be
disruptors.
able to return home later today.
Maybe they're really agents.
Some big
Think
picture
about it.
differences between this virus and previous ones.
Mhm.
Transmissibility, perhaps in between seasonal flu and SARS. Severity, perhaps closer to seasonal flu than SARS.
Severity closer to seasonal flu than SARS.
Nosocomial or healthcare associated spread was a major feature of the SARS epidemic, with large outbreaks in hospitals.
Now, do you not realize that for the past, over the past year, in my city, I would see a whole bunch of Asians with masks on. I'm asking myself, what the fuck? Why do they have these masks on? What would they know that I don't know? Boom! Kobe done died. The Wuhan virus came around. Now, let me ask y'all a question. You think they were privy to this information before they came down here from China and they didn't tell us? And now we caught up in the situation?
Were estimated to have been acquired
Because
from the hospital.
I love my
Patients already on a surgical ward,
Chinese fried rice and all that, but
that were there.
I ain't trying to catch no
We don't know how
motherfucking disease
large
over
a
this shit.
feature nosocomial spread
We haven't
is
bought Chinese
with
food in a
this novel
while
coronavirus,
now.
But that's one of the reasons it's so
Fuck.
critical to prepare.
I like
the
me some
healthcare
General Tao.
sector to take precautions for the healthcare workers
Shit.
and for other patients.
Beef and broccoli?
Another feature of the SARS epidemic was super spreading events, sometimes in hospitals with large-scale outbreaks when there were aerosol-producing activities, and sometimes in the community, as we saw with the Metropole Hotel in Hong Kong, where individuals who stayed in the same hotel the same nights as...
Oh yeah, in China, shout out to China because they built up a hospital in 6 days.
Became infected and brought the virus back to another
To house all the people that
that
were infected with the outbreak. So that's some serious shit. We can't get shit done in a whole year, and they fucking build up a hospital in 6 days. You know why? It's here is built on racism. They're so mad at the blacks that built this country and built these countries that they don't want us in the construction industry anymore because they know damn well that we would thrive and we would have our own multi-billion-dollar companies would funnel money back into the community and give us a better sense of pride and joy in what we do. And they don't want that. What they want is for us to stay at a low level and walk around acting like, oh, we got to do these service-based businesses so they could come patronize our businesses and try to make us look like we ain't shit. Where we could be in the industries and competing with them at a higher level. That's the fucking problem. And all we have is these fucking bootlegging and sellout entertainers that are there to pacify us, keep us at a low level or low bottom feeding frequency. And that is not the fucking way we go. I don't care what y'all think. This is not the way black people are supposed to be living and how we've been living. All we want to do is thrive and get up out of this mental slavery. And y'all know it, and y'all try to prevent that shit every step of the way.
As quickly as possible, whether there was a problem that might turn out to be worse, to not have penalties for prompt reporting, but to really promote openness. As we've seen with Ebola outbreak and with the current novel coronavirus, WHO and its emergency committee have been in the spotlight about whether they were declaring a public health emergency or whether the Director General was or not. This has been declared a public health emergency of international concern. The exportation of a severe, potentially severe virus to many countries certainly raised that threat. But I think we're learning more and more about how complex it can be to fully understand.
Come like it's scurvy. Remember scurvy, where they were spreading scurvy around the world because they didn't know how to clean themselves and bathe and all that? And now it went to Chinese. So think about it. These motherfuckers is over there eating rats, cats, and bats, and hats and ats. No, I mean ass. You know what I'm saying? Because I heard they eating carcasses now. You know what I'm saying? And if they doing that shit, yo, bro.
Criticism about could we have done more sooner.
It's time for a nuclear holocaust up with this motherfucker. No. Fuck that nuclear holocaust shit. An apocalypse. Like Tupac said, Tupacalypse now. Conscious and environmental change must take effect. Because we can't be living like this, man. We can't be eating anything and doing anything and moving any type of way. And then calling these people, oh, freedom of speech, freedom of... Nah, bro. But what they're trying to do is they're trying to break us down because we're the moral compass of the world. And they're trying to build themselves up where they're going to just continue this fucking nasty ass way of living and point the finger at everybody else except the white supremacists who perpetuates this nonsense. Let's keep going.
Only 2 individuals
13 confirmed cases in the Hubei
because they were essentially the partner of an individual who acquired the infection
province
in Wuhan. Our aggressive measures with our travel and border strategy and our contact tracing and investigation, release of the lab test, support of the repatriation flights has slowed the arrival of this virus. And we're working 24/7 to be ready for any worsening that occurs. I think with that, I actually want to make one more comment about a comparison between the novel coronavirus and many of these emerging infections in the past. The role that research can play is often very contentious, whether we need to respond to an outbreak or we can actually take the time to research interventions. In the 2014-15 Ebola response, we learned that it was possible to carry out investigational vaccine research in the middle of a terrible epidemic. And because that was done, we really actually now have a licensed vaccine against Ebola and a vaccine that was available to be used under investigational new drug.
No, you have the patent for Ebola. Now you have a licensed vaccine against it because you studied the fucking disease and you kept it in a lab which you created. So I don't understand what you guys talking about. You have something, problem, reaction, solution. You created a problem, now you have the reaction, and now you have the solution. So there's always an antidote to all your bullshit, but y'all can't fucking control all the diseases in the world. So you guys are gonna fuck around and quarantine and keep all these fucking things locked up in a lab somewhere, and there might be an outbreak. You never know. Instead of trying to eradicate this whole thing, we're giving each other vaccines and become immune to it. Does that make sense? They want us to be immune like mutants?
Investigations in the 6 states where cases have been confirmed, and we are trying to learn as quickly as we can about
Resident Evil bullshit,
spread
if
of
you
this
ask me.
virus. But we know that medical countermeasures like drugs and vaccines may take time. So I think with that, I'll turn things over to the moderator for questions, or back to you, Mr. Freeman.
Thank you, Dr. Schuckett. We're pleased to take your questions now. Aaron will be bringing the microphone to you. So why don't we start up here? We are going to ask that the journalists who are covering the event be allowed to ask their questions for the larger audience. Thank you. Please.
Thanks. Hi, Dr. Schuckett. Joyce Frieden from MedPage Today. I wanted to ask how you would advise doctors who are trying to calm patients who might be worried about this, and also if you could go a little into more the
Think up is the motto. So get your people together and think up a storm on how to eradicate the system of white supremacy and be on top of things. Because
versus the 10%.
these people
Okay.
are
Yeah, SARS was
the
10%
devil.
about,
No,
yeah.
I can't say they're the devil.
Then,
Let me tell y'all this.
and this,
The
well,
wealth of the
preliminary
wicked
data from China
is laid up
is
for
a
the
little
just.
higher than 2%. But
We
of
just
course,
gotta
have
do it.
0 out of 12
Like Nike.
here in the U.S. And there, the percent fatality among the individuals around the world, not in China, is much lower than the 2% out of China. That may be because we have such alert systems that we're picking up patients at a much earlier stage, or patients who were never going to progress to the severe pneumonia that was the tip-off of this problem in China. So what we like to do to really understand the mortality or the case fatality ratio, the proportion of infections that will result in death, is a larger scale assessment of both mild illness as well as severe illness. The initial tracking, understandably, was looking at people presenting with pneumonia who required hospitalization, and that would always be the more severe end of the spectrum. The issue for clinicians is a real one. We know that whether it's the acute flaccid myelitis, AFM, scary polio-like illness, or the H1N1 influenza at the beginning of the pandemic, anything that's novel can be scary before we know a lot about it. Zika, Ebola, of course. The circumstances in the United States are such that we have excellent surveillance for influenza, and we are aggressively looking for cases that might be the novel coronavirus virus, and so far have only identified 13 individuals. People who have cough and runny nose or fever are much more likely to have a normal, common respiratory virus right now. Now, if you're presenting after travel to Hubei province or after return from China, we want travelers to have their alert up and to let their clinicians know, I was recently traveling. They may need special evaluation, and the clinicians may need to take special precautions when they collect samples from them. So we've updated our recommendations both for diagnostic testing for workup of individuals as well as for protection of the healthcare workers. It's a critical issue. Right now, we're trying to find every single case of this novel coronavirus, but as I said, 13 versus the millions and millions and millions of cases of influenza that we've already had this season.
Yeah, we're going to come over to this side for a couple of questions, and then we'll come back.
Influenza, tuberculosis,
Thank you for taking the question.
AIDS, all of these things are
I
man-made
have a quick question.
in the lab
At the National Government
by
Association, Hawaii's
people that don't look like me.
that their concern was that they had to send the test off to the CDC, which took a lot of time. And you just said that you have now got these tests out to all the states. Does that include these the ones outside the continental United States and other territories such as Puerto Rico, Marshall Islands, all of those places?
Yes, that's right, and we've shipped kits to Hawaii, so for sure. We have, CDC has set up something called the International Resource Reagent Facility, the IRR, and that's a means by which appropriate laboratories can order reagents for this test. The test has received an emergency use authorization approval from the Food and Drug Administration and can be tested now at these state laboratories, as well as we're filling orders from other countries and from DoD labs around the world. So yes, that question from Hawaii, we have, I actually have confirmation that Hawaii's tests have been shipped. So, sure.
Okay, we're going to come up here.
Thank you. Sam Husseini from Consortium News. Obviously, the main concern is how to stop the virus. And
What about the 6 confirmed cases in Canada,
into the origins of this.
in Ontario? Talk about that.
Mentioned that there's absolutely no relation to the BSL-4 lab in Wuhan. It's my understanding this is the only place in China with a BSL-4 lab. We in the United States have, I think, 24 or so, and there have been problems or incidents. Some of them have been shut down out of concerns of leakage of pathogens. It's an ethical struggle.
They got 12 of those labs in the States, only one in China.
Attempts to make pathogens more lethal. And China is a very opaque society, totalitarian regime. We have no idea, but I don't know, you tell me, do you have any idea what kind of research could potentially be done? I'm not contending that this was intentional in any way. I'm just asking, is it a complete coincidence that this outbreak happened in one city of China with the BSL-4 lab?
That's a very, very poignant and good question.
Yeah, thank you for those comments. Based on everything that I know about what is going on with this outbreak and the research that's being conducted, as well as the genomic sequences that have been posted and the comparison with animal strains, this the pattern that we're seeing is quite consistent with emergence from animal to human
Consumption.
acquisition and adaptability or mutations that permit the virus to be
Animal to human consumption. Don't say acquisition. Acting like the fucking animals bit the humans.
The virus itself is
They bit the animals. See how she tried to word that?
There was an intriguing report about pangolin sequencing, an animal that is apparently a large part of the wildlife trade around the world, with 99% similarity, but what our scientists tell us is you actually need more like 99.9% similarity for us to understand origin. The animal origins and the circumstances of the emergence of this virus are really important to understand, and it's one of the key questions that the global community wants to look into. In terms of the question about gain-of-function research and laboratory issues, very important for us as a scientific community to have practices that protect researchers and their laboratory workers as well as the community around them, and that we use science for the benefit of people. So I am closely involved in this response, and everything that I've seen so far is very consistent with the animal to human spread that we've seen in other zoonotic origin.
Yeah. Okay, baby.
Yeah, let me make a few short. Let me just. Yeah. 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 Yeah, let me make a comment.
Let her make a comment.
Information is critical, and having the very best information available to those who, to everyone, to be able to protect themselves, their families, their communities is essential.
Mac Mizzles, the show. This is the Mac U presentation.
It is very common.
And basing life on critical knowledge, money, motivation over drama every day
So as you
is the
mentioned,
Block
the
Mode
laboratory
moniker.
and the center
an
of what else
acronym.
is happening in that province.
So,
I'm reminded of concerns we heard when I was in Sierra Leone in 2014 with the Ebola response. There was a concern that there was a hemorrhagic virus research center in Sierra Leone, and maybe that's where the virus had come from. It was a key rumor that had to be overcome in order to help control the outbreak. So based on everything that I know right now, I can tell you the circumstances of the origin really look like animal to human.
okay, I'm coming.
But your question, I heard.
Dr. Shuka, Dr. Shuka, MedTech Insight, Danny. You talked earlier about talking with people.
See, I'm out here doing my daddy duties, but I still keep the game with y'all because ain't nothing to do it, ain't nothing to it but to do it, right? I got us out here messed up. Like we don't know what time it is. I know exactly what time it is, son.
It's not time.
And you stop messing with this, little boy. And we're getting back to it. Now she's basically saying that
Because the Chinese promptly posted the genetic sequence of the virus, others were able to develop.
because the other viruses they found out it was in Sierra Leone because of the way they were
posted the
living.
sequences of the viruses that we've gotten from the cases here in the U.S.
She want to
But
be
we've
politically
also,
correct and not say nothing
prepared,
too damaging, you know?
Viral isolates that can be ordered by research companies, and that is through the DEI system that NIH runs. So we think that it's critical for the private sector to get in on the diagnostic development. The laboratory kits that CDC developed are really just the start, and commercial scalability of those will be quite helpful. The issue
Commercial
for
scalability.
medical
What the fuck does that mean?
device manufacturers, medical companies in general is both, they can be a huge help here, but we're aware of how interconnected our supply chain is. And there may, it's not just the medical devices, it's, your smartphones as well. And that Hubei province is a big industrial center, and that China, of course, is a huge producer of a lot of goods that are used as parts. So there's a lot of work right now going on to understand supply.
You probably make a lot of
chain
cell phones out in the
vulnerabilities
Hubei province.
and try to address them. And in terms of,
and
I
and
really
Wuhan.
don't have more information about the stock
Wuhan,
market to
I
talk
mean.
about, but I can tell you that a key principle is to use the scarce materials where they can be most helpful and not use them where they're not needed. We've seen sort of a run on face masks in the, or on the N95 masks in consumer stores, and the real thought about the N95 masks is those are really most needed in the healthcare setting and not, of course, not in the community right now. We're not seeing community spread here, and we don't think that the N95 respirators are really necessary or useful. But we want to make
What
sure
does
that
it spread through? Spread through touching, through coughing, through what?
Thank you.
Through the eyes? I've been hearing all types of situations. Y'all let me know.
Dr. Shukit, Benjung Cho with the Voice of America. Yesterday, WHO's international team of experts, advanced team, arrived in China, comprised of 3 members. And Dr. Tedros said that a larger member, a team, would go as soon as possible. That would be around 10 people. There were speculations that a CDC expert could be included in this WHO team. So could you tell us about the plan for an American expert to be included in that WHO team? And if you could share with us the conversations with Beijing to send international experts to China, and what could be some of the areas where China could benefit from American expertise in containing this disease? Thank you.
Yeah, thank you so much. CDC has provided names for the WHO team, and we are usually part of WHO teams. In fact, in 2003, I went to Beijing during SARS as part of working for CDC, but as part of the WHO response team there. It can be very helpful to
Why would they
have
even
outside
fucking name
experts
themselves that?
arrive in the midst
The WHO.
of an epidemic like this. Usually the
This is
public
fucking
health leaders,
Whoville?
the researchers and clinicians are so busy
Shit.
with that frontline response that having some fresh eyes, perhaps who have not lost as much sleep over the past month as the individuals in China, can be helpful. I can say in 2003 we were able to help launch a series of studies that helped understand super spreading, helped look at risk factors among people who didn't have a link with a case, so that the critical assessment of what the transmission is, additional evaluation of the severity, very critical right now for us to understand all the different routes of transmission, the full severity, which can help us with our models of what the impact may be if this becomes spread to many countries. And then following up on the other question, really understanding potential animal reservoirs, because if this did emerge from animals, it could do that again, or it may continue to do that. So those are the types of things. Whether there's effective strategies, one of the things
They're gonna ban you Chinese motherfuckers for being all this bullshit.
are some a big effort, but not as effective.
Let's see them
as
do that.
others, and how can we better control
Basically, she's
what's
saying
going on in China,
they're
and
still
also
trying to figure this shit out.
for others.
We don't know where it comes from. They know where it comes from, but they don't want to say it. And then trying to tell y'all, don't be fucking around with them animals. Leave the shit the fuck alone. Let's get it together. Let's figure out how this shit to contain this shit, and that's what we gonna do. But from now, we ain't saying nothing, and we keeping everything PC. It's your boy Mac Mizzle. I'll holler at y'all later, and do some research up on this. Let's talk about it. Comment, like, share, subscribe to my channel. You know what I'm saying? Hit the bell.
Either confirm
And you already know it's gang.
or find gaps that
And
might
remember,
help with
keep it real in the
strengthening
field.
things.
Forget
I
how
think
they
that,
feel.
China has been working